Honorable Minister of Health and Family Welfare, Sir Zahid Malik, high officials from the Ministry of Health, distinguished guests or consultants, specialist medical officers, nurses, allied health professionals, support staff, and nursing students of the Sheikh Fazilatunisa Mujib Memorial KPJ Specialized Hospital and Nursing College. Alhamdulillah, Alhamdulillahi Rabbil Alameen, wassalatu wassalamu ala ashrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajma'in. Alhamdulillah, let us all raise our hands in praises to Allah subhanahu wa ta'ala, as it is His blessings here today that we are gathered to receive a very special guest for a very special visit to our hospital this morning. And we are indeed very proud and honored to have your presence here at our hospital this morning, sir. On that note, let us all give a big round of applause to our Honorable Minister. Respected Sir, distinguished guests, ladies and gentlemen, I would like to begin our session here today by welcoming you once again to our hospital. And I would like to now begin to present to you the progress of our hospital thus far, and where we are, where we were, where we are now, and where we are heading to. Once again, welcome. And it's a beautiful hospital, as you can see here, by the lake, rowing on a boat, watching the hospital from the lake, the beautiful constructed and developed hospital. Okay, or even individually, in all of us, we must, or we have our own vision. That means our dream of what we want to become and what we are to be. And similarly, at our hospital, we have our own vision, that is the preferred healthcare provider. Meaning we'd like our hospital to be the preferred hospital compared to the other hospitals. And with how do we achieve this? Our mission by delivering quality healthcare services. And we embrace the following core values. Yeah? And number one is safety. Not only safety for the patients, safety for all of us here present today here who patronize our hospital. And we embrace on safe outcome, safe procedures, following good medical practices and clinical standards. And we have committees to monitor and administrate the clinical governance, clinical standards of the hospital practices. And number two is courtesy. Yeah? Like in anywhere else, it is no point of having a beautiful building, a beautiful hardware, an upgraded hardware, but the soft skill is not there. So courtesy is one of the core values that we embrace here very much. And of course, professionalism, the way we groom ourselves, how we present ourselves, how we communicate to the patients, and how we conduct ourselves in our day-to-day operations as a healthcare provider must be shown according to the respective professionalism of the respective fields of practice. And last but not least, continuous improvement. And we encourage very much feedback from patients, comments for us to improve continuously. And we take the feedbacks, whether it's positive or negative, we take the feedbacks constructively. It is an opportunity for us to improve ourselves further. I am representing KPJ Healthcare Berhad, coming from Malaysia. KPJ is one of the largest, or if not the largest, hospital network in Malaysia. It now owns and manages 29 private hospitals all over the country in Malaysia. And we have 2 hospitals in Indonesia, and of course 1 in Bangladesh, and when we have 1 associate hospital that we manage in Bangkok. Managing hospital is our competency. And just to show you some of our hospitals that are available in Malaysia, this is KPJ Damansara. This is the 29th hospital in Malaysia, in the KPJ group. This is located in Selangor or nearby Kuala Lumpur, and it is more for health tourism. And we have next in the northern state of Malaysia, the Kedah Medical Center. Kedah is like a division here in Bangladesh. So Kedah is one of the division, or in our case we call it a state in Malaysia. And then we have this Ampang Putri Specialist Hospital, also in Selangor, 200 to 300 bedded hospital. And Bandar Dato' On is in Johor Bahru, nearby Singapore. It is a specialized hospital also. And the KPJ Perlis, the northernmost state in Malaysia, there's also a hospital. And in Selangor again, the KPJ Klang Specialist Hospital, just to show you a few of the hospitals that we are operating in Malaysia. And we also have the KPJ University College. And this college offers from the Diploma in Nursing program, diploma programs, degree programs, master's programs, PhD programs, and also the specialties in medicine, in orthopedics. You know, anyone who wants to become a specialist or consultant in any field, there is a provision. The university provides those training. Because we have more than 1,000 consultants, you know, and all these people who enroll in this specialized program, they are tagged with the respective disciplines that they are enrolled with. If we are enrolled in the ENT program, so he or she will be tagged with a consultant ENT and supervised by the consultant ENT. And this program has been going on. And we have produced thousands of nurses, thousands of allied health professionals, thousands of, hundreds of hospital professionals, and also produced specialists and consultants from this university college. Okay, sir, and ladies and gentlemen, I would like now to present to you our 5 years historical operational performance of our hospital. So we'll be presenting the 5 years historical performance of our hospital. Although we've already started maybe from in 2014, so we'll be presenting to you our last 5 years historical performance. And firstly, the number of occupied beds, actually. We increased the beds from 50 to 80 in the year 2019. And until now, the number of beds remain at 80 beds. The bed occupancy rate, as you can see, as presented there from the presentation here. So in 2022, we registered a bed occupancy rate of 67%. That means about 55 or 56 beds are occupied during the year. And although it is 67%, but there are times, this is average, but there are times and days where our occupancy like 80% or 90%. But this is on the average, it is 67%. Number of patients, as you can see, it has grown from 2000. So the trend here, if I could just explain a little bit, 2018 we registered 110,000 and it increased to about 147,000 outpatients in 2019. We were expecting 2020 onwards. We forecasted when we prepared our budget for 2020 onwards, we expected better things to come for us. and getting from the results of 2019. However, as we all know, COVID-19 pandemic came in, so we were badly affected. We, as you all know, we were worried, panicked, and so on and so forth. And such was the performance in 2020. And in 2021, Alhamdulillah, with the support from the Ministry of Health also, we got some equipment to manage, to admit, to treat and manage COVID patients. And with that, our occupancy in 2021 increased by 69%, and our number of outpatients also increased 142,000, although it's still below the 2019 pre-COVID. Yeah, pre-COVID is 152. And Alhamdulillah, in 2022, we have surpassed the 2019 147,000 number of outpatients to 159,000 in 2022. So we're looking at about 400 to 500 outpatients per day. And number of inpatients, similarly, and as you can see, 2019, 6,000. So we can leave 2020, put it aside, and look at the 2019 and 2021 and 2020. And similarly, and the number of surgeries also has increased from 2021 also. And Alhamdulillah also, the number of consultants, it has gradually increased. It is the most challenging area for us to manage. As we all know, majority, or if not all, I think all of our doctors here are staying in Dhaka. And some of them are residing here in our campus, in our residences. But majority of them are staying, and we provide transport services for them to commute from Dhaka to to the hospital. And maybe you're talking about to and fro about 4 hours per day when they come here. And so they come out in the dark and go back also in the dark. So that's basically, and that's the challenge. And Alhamdulillah, we have a very good team of specialists and consultants here, very loyal, and with good cooperation and understanding, and the support, especially during the COVID. We had cash flow was we were badly affected by cash flow. We had to borrow money from our father. Hey, help, I want to pay salary, please give me some money, and those kind of things. So those are the challenges in 2020. And our staff now total about 462. 462 now, comprising of nursing staff, clinical staff, and support staff. And the other services that we like to present here, we have our very own cath lab. As you can see from the numbers here, from 2018-12, now we are doing 165 angiograms in the year 2022. And angioplasty is 87 that we have performed in 2022. We have 2 cardiologists now in our hospital. And the other areas under the cath lab or under the cardiology, the temporary pacemaker, that is also being performed at our hospital. And in the special diagnostic, we have the echo, color Doppler, Holter, ECG. We have the stress test. So, and the numbers are there for you all to see. And then deliveries, Alhamdulillah. Last year we recorded 330 deliveries in our hospital, 50 more than the previous year, and it has increased even. It has surpassed the 2019 number of deliveries to 330. And dialysis also shows a very encouraging figure. Alhamdulillah. Education and awareness. Alhamdulillah, we have our very own nephrologist, Dr. Nizam, who is, in his area of practice, encouraging, because dialysis is a very expensive disease. Clinically, good medical practice, good standards, you have to do 3 dialysis in a week. So the patients that come here, Alhamdulillah, rather than not doing dialysis at all, at least they come for 1 session or 2 sessions in a week. Affordability comes into place. So if you're charging 2,000 taka per dialysis, you do 3 dialysis, 6,000 a week, 6,000 times 4, you're talking about 24,000 in a month, and 24,000 times 12 in a year, how much they would have to spend on dialysis, unless they go for transplant. You know? And we are seeing more of them, the dialysis patients. So a very more than triple jump from 2021 to 896 dialysis. Physiotherapy also, we get outside referrals to do physio rehabilitation sessions at our hospital. Laboratory, other than investigations ordered by own consultants, we also get referrals from nearby clinics, nearby diagnostic centers, and similarly, in the pharmacy also, we have performed quite well, 6,000. And the accident and emergency, we have increased better, in 5,680 in 2022. And also have the ICU services and the NICU services. And we are proud to say that we can call ourselves a center of excellence in neonatal intensive care unit. Yeah, and as you can see from the numbers, we registered 1,082, attended to 182. And in the radiology, we have the various modalities: general X-ray, CT scan, ultrasound, MRI, BMD, and recently the dental OPG. And we also have recently also added mammogram into the radiology services. And from the numbers, you can see that we are recording quite reasonable numbers for our radiology services. And we also do oncology procedure. That means we do chemotherapy. We have a visiting medical oncologist practicing at our hospital, and we provide the chemotherapy services. And whenever patients require radiotherapy, we have a close collaboration with the Atomic Energy Commission, who has a full-fledged radiotherapy services there. And we arrange and manage the patients requiring the radiotherapy to go there and have the radiotherapy sessions. And of course, all the scope services that we are providing at the moment, and these are the figures that we have, it has been increasing throughout the last 5 years. And so too, which we introduced in 2021, biopsy, fibroscan, superficial radiation therapy for the ENT, the PTA, tympanometry, and we also have a dedicated breast care clinic managed by a medical officer. So, as you know, breast care is related to females, and to add comfort to the services, we have a female medical officer to at least screen and and try to diagnose whatever before the patient is referred to to the general surgeon or any specialist required, if required. Yeah? So, and COVID treatment, as I've mentioned, in 2021, during the COVID 2020 PCR tests, alhamdulillah, also we also supported by we provided by the RT-PCR molecular facilities, and thank you very much. I think we worked well together with our civil surgeon and many communities all over Gazipur. Also, samples are being sent to our lab for tests in 2020 especially, and it carried on in 2021, and of course by now tests have reduced anywhere in Bangladesh. And for inpatients, when COVID pandemic came in, we did not admit any COVID patients because we were not ready. We did not have the facilities, especially critical care equipment. So we thought, we just do the test, and then when in 2021, when we knew that we were ready, so we admitted and treated COVID-19 patients, and Alhamdulillah, the response was good, and I think the team of doctors were managing COVID patients. I think they have successfully carried out their work to give the best services for COVID-19 patients during that year. Okay, so with that is in a nutshell our progress of operational performance for the last 5 years. To continue with the presentation, I would like to invite Dr. Razif, who will present to you much of the clinical side of the hospital, our achievements, our success stories, and where we are going to go, and where we are now in terms of facilities and services. So I invite Dr. Razif, and I wish to thank you, sir, Honorable Minister, for coming here to visit us and see how we are, and inshallah, with the close cooperation, rapport with the various authorities, I think we can work together and make this hospital as the best hospital surrounding these areas from Manikanj, Sabah, Tangil, and so on. And inshallah, we'll be increasing our marketing efforts to the capital city of Dhaka, where all the high net worth patients are located. And and since now that we have already upgraded, added or replaced our machines from medium to high-end machines, I think we are ready to serve anyone in the country from anywhere. Yeah. So with that, once again, thank you very much, Honorable Minister and high officials from the Ministry of Health and everyone. Thank you. I now pass to Dr. Razif for the presentation.
Thank you very much, sir.